talking candidly about sex as it relates to this pandemic. Dr. Theresa Tam, Canada's Chief Public Health Officer, has this advice for those who want to have sex with a person that is outside of their household or their bubble. Wear a mask. Yeah, wear a mask. Skip the kissing and overall avoid face-to-face contact or closeness. Well, that raises a lot of questions, right? Tam says that people should not have sex with someone who is infected. I think we all know that. Joining me now to talk about this is Sira Madad. She is the Senior Director of the System-Wide Special Pathogens Program Office for New York City Health and Hospitals. And Sira, do you agree with Dr. Tam's advice? What do you think of it?
I do agree. Any close contact with an infected person is a means of potential transmission of COVID-19. So regardless of the activity or act that you're performing, you're obviously putting yourself at higher risk. And so, putting in mitigation measures like wearing a mask and not engaging in, for example, kissing that can exchange, saliva, that's a way to prevent transmission.
And I wonder, Dr. Madad, do you think that people are going to follow this? I mean, I think, for instance, of, young people who are dating and they're saying, really, you're telling us that if there is dating and that there is sexual intercourse, that we should wear a mask and that we shouldn't kiss. Obviously that really changes intimate relations as we have known them to be.
That's correct. It goes back to risk reduction. So we know that, when you're engaging in these types of acts, it increases your risk of getting exposed to COVID-19. And so the best way to provide education is to tell them what you can do to decrease your risk. Telling them to completely abstain from these types of activities will just basically have people doing it, behind the scenes, if you will, and doing it unsafely. And this is why it's important to provide this type of information, because an abstinence-only approach has never worked. We've seen this with HIV. We've seen this with other sexually transmitted diseases. Not to say COVID-19 is sexually transmitted. We are still investigating the means of transmission, but we know that exchange of, for example, saliva. And we also seen that, COVID-19, you have particles in semen and vagina and fecal matter. And so coming in contact with those potentially may increase your risk. And so it's just good to follow this public health guidance. The other thing I'll just quickly mention is, people think that, if I've tested for COVID-19 and I have antibodies, well, then I don't have to wear a mask. And that's not true. It doesn't give you a clean bill of health in that sense. And so we want to make sure people also understand that maybe even if you've had antibodies for COVID-19, you still need to wear a mask if you are engaging in these types of acts outside of your household contacts.